know what is this? Nature has endless treasures of beauty in the form of its various beautiful creatures. Nature is vast and full of such miracles that comforts our emotional and physical senses. Nature has beauty of refreshing sky, the snow-capped mountain, and the deep green valleys. To see from the magnificent sun to the beautiful moon, to see from the great oaks to tiny bush, Almighty has blessed us with this beautiful creation called eye. Imagine if a person is unable to see. He becomes vulnerable and his life becomes colorless with continuous sense of social isolation, anxiety, fear and feeling of dependency upon others. What do blind people actually see? Just try to feel this darkness and imagine the feelings of the patient. Being an ophthalmologist, our aim is to try every possible source to help the patient in restoring her best corrected visual acuity. Such is the story of our patient Janita, who got cornea transplanted in the year 2023. Here is the short story of our patient, which briefly describes how she got the disease, how we admit her, how we received cornea, how we operate, and how the patients feel. Name Janita. Diagnosis corneal dystrophy. Here is the short playback of patient life. Patient Janita, resident of Mian Shanu, Pakistan, presented to eye-op with decreased vision which started when she was 7 years old. Just imagine a young, energetic girl, full of life and having dreams of a better life, presented to us just with the hope of help. I am Nasreen Rashid. I am Mother Janita. We are residents of Mian Shanu. Janita was the girl full of life. She did her schooling until her 3rd standard, but then she started complaining of decreased vision. Her class fellows started stigmatizing her due to the blue appearance of her eye, and my girl lost her confidence and most of the time she started locking herself in the room. We prayed to Almighty, please help us and restore her vision. A hope of better life motivated the patient, and she came to Nishtar for keratoplasty.
This is Multan, the city of saints.
Multan is the 5th largest city of Pakistan, with an estimated population of 70 lakhs. The tomb of Bahaddin Zachariah is a distinguished feature of Multan. Nishtar Hospital, Multan, which was inaugurated in 1952, is serving the people of South Punjab from its very first day. It's present in the center of city with capability of 1,400 beds. The ophthalmology department is one of the most well-equipped department of NMU. Professor Dr. Rashad Kumar Rao is the head of ophthalmology department. How we receive cornea? After our agreement with FOTA, our friend in USA and APNA team members, especially Dr. Fad Zafar, and in 24 members Dr. Shahid Khan, Dr. Rafiq Anjum, Dr. Shahid Akram and Dr. Sadiq Tasneem, help us for the corneal transportation from USA to Lahore via air travel. And then to Multan via bus travel. Then the cornea are received by the keratoplasty team and the concerned members at USA are informed. Then the legal documents verified. Endothelium counts identified and cornea transplanted to patient accordingly. How a patient is selected and prepared? Generally, we prefer a patient having bilateral decreased of vision, with having minimal risk factors of rejection. Then keratoplasty team member checked the patient and registered him or her in our database, and patient is called whenever cornea are received from USA. How we operate? you know what this is? This is not just cornea, but a hope of new life, a hope to have a better future, a hope to work and to fulfill her dreams.
Kindly introduce yourself.
I am Janita. I am from Mayan Shanu. I am 15 years old.
For how long you have decreased vision?
From my early childhood,
What difficulties did you face due to your weak sight?
I was unable to do my daily chores.
Do you know which procedure is performed?
Yes, keratoplasty.
How are you feeling now?
Much better.
Did this whole operation cost you anything?
No.
How is your vision now?
Alhamdulillah, good.
Anu, further comments?
I am thankful to Dr. Rashad and Dr. Shahid.